Now, there are so many people who wanted to give a shout out to a healthcare worker today, and one of those is Michael Rajales. Michael spent 72 days in hospital with COVID last year, including 14 days in the intensive care unit, and is still suffering the effects of long COVID.
He wanted to give a big thanks today to the nurses who looked after him, in particular the nurse unit manager, Rahika John. And he says she always went above and beyond, and it meant so much to him in such a difficult time.
When I got moved from the ICU to the ward, I was very weak. I couldn't sit, I couldn't stand, I couldn't walk. Radhika's team helped feed me because I couldn't even hold a spoon. At the time, I didn't realize that she was the unit manager of the ward. But she would come checking on me. Sometimes she would buy me a coffee, and sometimes she would wheel me out and buy me brekkie and take me outdoors so that I can have just a breath of fresh air. I had very limited contact in hospital, and those little expressions of kindness I really treasured. On my last day, the whole team, including Radhika, the team of nurses, were lined up in the hallway, and they just clapped their hands as I was being moved out. I will never forget that. I just want to say a really big thank you to the team at Monash, Radhika's team, to Radhika, a special thank you to her as well. If I can give you a big hug, I would. But a really big thank you, and keep doing what you're doing. God bless you.
And we are so pleased to say we have Rahika John with us now. Radhika, a very good morning, and from all of us, a big thank you too.
Oh, good morning, and thank you for having me.
What does it mean to you to hear Michael Rajales, one of so many patients you've dealt with, but Michael in particular, say such kind and loving words about the care you and your team provide?
First of all, I'm so humbled, and it's actually a privilege to have looked after Michael and many other patients throughout our journey with COVID. I think one of the most important lessons I was taught by my mentors is that people will forget what you do, but they will never forget how you made them feel. So that's a principle I live by with my everyday work. And of course, it's not only myself, it's a team effort. And how we worked as a team in part of Michael's recovery, I think it's incredible and something I will always remember throughout my career.
Take us through your average working week there at the Monash Health Centre. Radhika, how busy are you with, sadly, COVID cases on the rise again in Melbourne?
It's extremely busy. It's not just the physical sort of work, but it's the mental and emotional build-up as well that it gets. As a leader, I'm only as strong as my team, and I work with an incredible bunch of nurses and doctors and allied health teams, including the PSAs and the cleaner. We are all correlated and codependent in what we do every day. So the stronger we are as a team, it displays in our everyday work. So it is challenging at times, but we get through it as a team.
You're dealing with COVID patients, but you're also dealing with other patients with other medical challenges as well. That hasn't stopped, has it?
No, it hasn't. But it's a privilege. I think for me, the greatest honor is to serve humanity, and that's my calling in life. And it's a privilege to be in such a point as this in my life and in my career. And I'm sure good days will come. This is just the middle of our journey. Good days will come.
Good days will certainly come. How long have you been a nurse, Radhika?
This is my 13th year at Monash.
And what do you talked about the joy you get from hearing patients like Michael thanking you, and Michael saying how easy you and your team made you feel. How important is it, as you mentioned your staff, but I want to also give a shout out to your staff through you, how important is it that you have a really good team around you?
It's pivotal, I think. My team, each one is so unique and so special into what they bring to the role in their everyday work, and they add a special touch into the care we deliver. And I'm proud to be an employee of Monash Health. I'm proud to be a healthcare worker, and I'm proud of my team.
Hey, Radhika, I know I speak on behalf of all of our audience watching, not just in Melbourne, but right around the country. We are all proud of you and we thank you for all the hard work you and your team have done and will continue to do.
Oh, thank you so much. And thank you for having me.
No, it was our absolute pleasure. Radhika John there from Monash Health.